NHS if they have any concerns?
It comes as the government urges doctors to prescribe antibiotics proactively in schools where there have been cases of Strep A, with potential for penicillin to be given out en masse.
Well, with us this morning is Chief Executive at the Association of Independent Multiple Pharmacies, Dr. Leyla Hannbeck. Good morning to you. Look, I just want to draw your attention, first of all, to the front cover of the Eye, Antibiotics en masse for children in Strep A schools. I mean, both Martin and I are aware of cases of Strep A in our children's primary schools. There's a huge deal of concern amongst parents, understandably so. My goodness me, 5 times the normal levels of deaths amongst children from this. And yet handing out antibiotics like Smarties, is that the right approach?
Well, from pharmacy perspective, we've certainly seen much higher levels of antibiotic prescribing compared to previous years. I mean, this year it's been, they're flying off the shelves really. And that has actually led to the fact that, supply of these have also become a concern in terms of how we actually manage to source these out from wholesalers and manufacturers. But I think as a parent myself, obviously everyone is very worried about what is going on. And I think local guidelines are something that are being looked at on a regular basis and updated in terms of what needs to happen with the prescribing.
Yeah, I'm a bit concerned that this is a very early stage of a fresh outbreak, and there seems to be a panic already. Yesterday we heard there's not enough antibiotics. Now we're hearing antibiotics for all. I mean, is the NHS really in a position to handle another mass outbreak of a virus like this?
Again, this year as well, we're seeing higher levels of cold and flu, and it's known that if you have cold and flu, you're more prone to pick up infections as well, particularly in amongst little children. But what we need to be careful about here, if we are asking for antibiotics to be prescribed, obviously we need to think about the supply side of it as well. That it's one thing prescribing antibiotics, another thing parents going into pharmacies and not being able to get these.
For us, because Downing Street deny there's a shortage of specifically amoxicillin, which is used for this, and yet pharmacists that we're speaking to saying, as you are, there's a problem from the wholesalers' side. So which is it?
Well, the latest times we checked that was yesterday evening, and there were red flags coming up on the wholesalers' lists in terms of out of stock, and out of stock. And when you actually get these coming in, then, as I said, because of the level of prescribing, they are, running out. So it's a matter of, the stock being patchy. And it's worrying.
Supply chains, or do you understand anything about why we have a shortage of, say, amoxicillin at the moment?
But sometimes it's supply and demand. Well, that affected. Do you remember the HRT thing that we had, earlier this year? But also, the global market in terms of the pandemic has affected it. The lockdowns, in the Far East, affecting the raw material availability, fuel costs, and everything else that adds to it. But also at the end of the day, it also comes back to supply and demand, and the demand is very high.
And it's interesting how lockdown supply chain issues are being talked about in terms of the pharmacy side of things, and also the lack of children mixing, which is healthy for their natural immune system. So can we just conclude that lockdowns were disastrous for children's health?
Oh, that's a very difficult question you're asking me. I think, obviously, the facts remain that if you don't mix, your immune system is not as strong. And, I can see that with my youngest kid in comparison with the other 2 kids. He's a COVID baby, as we say, and immune systems are a bit lower. But at the end of the day, it comes back to this winter is also being harsh in terms of the cold and flu amongst the population.
Well, anecdotally, at my school, there's been a load more norovirus than I remember in other years. There's certainly been at least 2 bouts of it going around the school. So, I mean, it seems, at least anyways, there's a lot more nasty bugs.
Yes.
Can I just ask on the issue of antibiotics? I mean, we've all been trained, haven't we, as parents and as a society, that we should try not to overuse them because we end up with resistance, and in the future we create problems for ourselves. So it's trying to strike that balance between parents who are absolutely, understandably terrified for their children and the future.
Absolutely, and that is the key thing. And as healthcare professionals, we have that antibiotic stewardship in terms of making sure that overusage of antibiotics don't happen. And then you have scenarios like this, and it's having that balance in terms of like, what do you do? And at the end of the day, that's why it's important that these guidelines are reviewed on a regular basis. So as healthcare professionals, we know what we're doing as well.
Okay.
There's just so much confusion. That's what I think is the issue here. Is on the one hand, we can't get stuff. On the other hand, it's stuff for everybody. And then do you find as well that people are buying their own medicine online? 'Cause you can do that now, can't you? People are kind of short-circuiting even the diagnosis stage.
Yeah, and I think that's a worry that we have again as pharmacists, in that, first of all, people start self-treating. So if they have any old antibiotics at home, they think they can take that, and we strongly advise against that, because antibiotics don't work for everything. You know, if you have a cold and flu, a sore throat as a result of a cold, it doesn't really help taking antibiotics. But you know, going online as well, because people then think, okay, well, if I cannot get it here, let me go online. You don't know what you're getting, because sometimes it's not antibiotic that you're getting, something else that you're getting. So don't treat yourself with any of these medicines. And you know, we worry because people ask these questions. Definitely the advice is speak to a healthcare professional.
Okay, really good to get your take. Dr. Leyla Hannbeck, Chief Executive of the Association of Independent Multiple Pharmacies. And if she's saying there's red flags from wholesalers out of stock for amoxicillin, you would know. Thank you very much indeed. We will be speaking to the Schools Minister, Nick Gibbs, a little bit later, in around half an hour's time, and we'll get his take on what's being done in schools to cope